Similarity's predictive archetypes. By definition, an archetype is a model after which other things are patterned. And this is how we use that description of archetype for Simularity. Our predictive archetypes are a weighted list of features that describe a group of items. So that weighted list of features is the model. And it's generated by looking for features that are highly correlated with the specified group. And you can then use this model, this weighted list of features, to score or estimate the probability that other items might belong to the group. Using a predictive archetype is pretty easy. You define the group that you want to model. You view which characteristics distinguish that group, and then optionally you can score others based on the matching characteristics that they have to the group that you're modeling. What's great about this is you don't need to know which questions to ask. It looks through all of your data to find the most correlated features with your group. And you get more than just a predictive model. You get explanations. You can see why these features are correlated with your group and to what degree these features are correlated with your group. We're going to use an example with some healthcare data. This is based on 28.8 million emergency department visits from the HCUP government. And let's say we want to look at overall risk factors for type 2 diabetes. Then for the patients that we have, we want to determine which patients are at risk for type 2 diabetes, how high is that risk, and what are their individual risk factors. So we've built a UI here, so it's basically point and click, and you can just enter the ICD-9 diagnosis codes for type 2 diabetes, and then it's as simple as clicking on process here to create the predictive archetype. This is what the predictive archetype for type 2 diabetes looks based on the data that we have. Now, based on your data, it might look entirely different, but this is the predictive archetype based on the data that we have. And you can see things like aortocoronary bypass, a lot of other diagnoses that are correlated with diabetes. These numbers over here on the right are the rate ratio for each of these features. In this case, these features are diagnoses. And a rate ratio is the number of times more often that this diagnosis occurs in the group of people with type 2 diabetes than it does in the general population. So you can say people with type 2 diabetes are 4.5 times more likely to have an aortocoronary bypass than the general population. So then it's really easy to score your patients against that. And here's an example of the patients that we have that are at highest risk for type 2 diabetes, but have not yet been diagnosed with it. And these numbers here are the probability that these patients should belong in the group of patients comprise the predictive archetype. In this case, it's type 2 diabetes. And then for each patient, we can examine their individual risk factors. So this is a view of the record that we get in the NEDS data. And you can see that the risk factors for this patient are highlighted that match the predictive archetype for type 2 diabetes.